Yeah, that's more universal for everyone.
Yeah. Okay. I think it's recording now.
Yes, it is.
Okay,
You
so
can
let's
just pause it.
recording. Okay. So, first of all, Happy New Year, everyone, and thank you for being here to this wonderful workshop by Karen Heskett, our wonderful librarian. I already heard this workshop because she did a private version of it for our department, T32 leadership teams, and it was so good that we decided we wanted to have a second version of this for everyone. So as you know, there has been a lot of changes around requirement for publication and being compliant with the NIH. And Karen put together this wonderful presentation. It's pretty dense. There is a lot of information, borderline overwhelming, at least for me. And she will stay, she's a wonderful resource. And so you can always circle back with question. Okay, and so I'm recording this and we will share it with everyone because I already got quite a bit of requests from people that couldn't be here. And I see over 50 people, so there is definitely a lot of interest. Okay, Karen, thank you. I leave you the
Great.
floor. Thank you.
All right. And I also have one of my colleagues from the library here joining us. Her name is Allegra Swift. She's also a great resource for publication questions, open access questions, and she'll be chiming in as we go along. All right, so let me share my screen and we'll get going with this. And I'll invite you anytime you have questions during the presentation today, please just let me know. My computer seems to be a little bit on the slow side. Um, it's a Friday and all right. Can everyone see that okay? Okay.
Shaking my head.
Okay, great. All right. So these slides are in Google Slides. So if you just wanted to capture them real quickly, you can, on your phone, take a quick snapshot of that QR code and it'll take you back here. But I'll also send the link on so that everyone will have that slide. I'll send it on to your organizers. I wanted to go over just a couple of things, basically what I'm calling the big change, but also get into some of the details about these new requirements and talking a little bit about open access and the UC agreements. There's a couple of things that publishers are doing with this new rule, and so we'll cover a little bit of that. And I'll have some resources for you so that it's not just my words that you'll be hearing today. There'll be some places to go and get more information. All right, it looks like we have the link in the this chat. And Allegra has chimed in with a link to our scholarly communications uh, website on the library. All right. I wanted to acknowledge real quickly that this is a combination of what I've known, what I found, but also some of the wisdom from some of my UC colleagues. All right. So when we get down to it, the big change really is what's called the 2024 Public Access Policy. For NIH, it is live now. For other federal agencies, their deadline was the end of 2025. The change is the zero embargo period for the author accepted manuscripts. So previously it was 12 months, now it's a zero embargo time. Given that publishers support this, some of them do, some of them do not. And so it has changed some of the publishers that used to deposit for the authors, there is a small handful of journals that are still doing that. Most of them will not do that anymore. So just a quick overview of what the policy was. It started in April 2008, looking at three things. Is the article peer-reviewed? Is it the result of NIH funding? And was it published after that date? And those are the things that NIH is looking for compliance. And that at that time it was 12 months. There was a little bit of a tweak around 2016 when they found that very few people were complying. And so they wanted to see evidence of the process with the NIH manuscript submission system, and they put a timeline of about 3 months on that. And so articles were starting to fall into non-compliance because even though you had 12 months for it to be there, you had to show compliance within 3 months. And they started rolling out some consequences, what they were withholding payments to grants. And so it also came about around that time that if you wanted the RPPR to grab some articles, you had to put them into your My Bibliography so that you could enter them into the report. So just so you know, if you hear these phrases, there's something called the Nelson Memo, OSTP. This is the beginning of the change for the open access, basically. One of the changes is it will now apply to all federal agencies, not just NIH. So one of the things that was available once this memo came out is that each of the federal agencies could do some small tweaks. And what NIH did is they bumped it up a little bit. The date there was the December 31st, but with a new NIH director in April of 2025, accelerated that date to July 1, 2025. So here's how that plays out. If you have an article published June 30th, 2025, you have 12 months for compliance. If that article were published July 1, 2025, there's a zero embargo rule for that. So as soon as there is an official final version published by the publisher, by the journal, the author accepted manuscript has to be made available in PMC. That very much accelerates the process of getting the manuscript into PMC. There are some things that are sort of, it's hard to say they're best practices because it's just come out, but there are some things we're going to talk about to minimize some of the confusion about the publishers pushing back about this zero embargo policy. So just a couple of things to hopefully bring the old into the new. A lot of the policy is of the 2024 public access policy is very similar to the old policy. Dates, the zero embargo is different. How things are done is still the same. The author accepted manuscript being deposited into PMC, at least with the experience that I've had with a few people around campus. It is oftentimes the majority of cases where that author accepted manuscript needed to be deposited. Some of the new things that have come out with the policy is the suggestion of some wording to acknowledge the federal funding. Now, almost always, I've seen people wanting to be compliant, and they can see that the authors have acknowledged at least the grant itself with the grant number in acknowledgement usually. But there's some wording that NIH came out with that will make it clear to publishers. And the one tricky bit with this new policy is that official date of publication. It's when the final edited version is available online or in print. And that can become a little bit tricky for people who use PubMed because oftentimes an entry in PubMed is online ahead of print and may actually not be the final version of record. How do you deal with that? So we'll talk about that in just a quick second. But I acknowledge that this part, the official data publication, is probably one of the vaguest, hard to apply items. And so we'll work on that. A couple of definitions. Author accepted manuscript. This is that final version from the team with the post peer reviewed edits, and it's the last one uploaded to the publisher. That actually, for a very long time, has been something that the authors have copyright for. You could do a lot of different things with that. Different different publishers had different rules about embargoing that. So you couldn't just take your author accepted manuscript and put it on your own website or in a repository until UC came along and made some changes with that. But that author accepted manuscript is your copyrighted work. The final published article, that's the journal's version of things. You do not have copyright permission to that because in your author agreement, this is the version that you've given to the publisher. We talk about official data publication. Something that I'm going to be mentioning shortly, if you're not familiar with that, is the NIH manuscript submission system. Was there a question? Okay, just a little echo I heard then. And so the NIH MS is a place to put your author accepted manuscript. PMC and PMC ID, these are not PubMed or the PubMed ID number. PMC is a sister site to PubMed, and it's where the full text goes. And so it gets its own unique identifier. And then Medline, for those of you who have been around long enough to recognize that name, this is the majority of PubMed. It is not exclusively only what PubMed is. PubMed is a collection of different things, but Medline is a specific database, and you can get to Medline and the records in Medline through a variety of sources, but it is most of what powers PubMed. All right. So this is just a quick representation of what the NIH manuscript submission process is like. Someone deposits, there's an initial approval, conversion, final approval, you get the PMC ID assigned, and it's available in PMC. And as you can see, this is not something that happens overnight, even though it's mostly an online process or email approval process. This is not something that happens within 24 hours. It does take a process, a little bit of time. I mentioned this a little bit before that publishers used to submit for, in certain circumstances, for the author. And I have not found the same publishers doing that again. Right now, it really is almost exclusively up to the authors to deposit their author accepted manuscript. You can see that there's a list of some journals that do that. So if you wanted to take a look and see what journals do, um, uh, there's still, somebody collected this. There's still a small list of hybrid journals. And by that, I mean they publish sort of the typical subscription-based model as well as open access. That's why they're hybrid. There are a few that you can arrange to have it deposited. So that list is there. So is publishing open access a requirement with this new policy? And no, it is not. This policy has never been forcing open access. In fact, if you publish open access, you still have to get, excuse me, you still have to get something into PMC, whether that is the open access PDF from the publisher or the author accepted manuscript. And so that is, for some, it'll be something that is beneficial to the budget because not everyone has fees for open access publishing, which is becoming its own little quirk. And we'll talk about that in just a second. Open access publishing cost, there is a cost to that. And some grants have written into the budget fees or funds anyways to publish the open access fees. And reasonable costs associated with publication. This is something that is in the process of being discussed by NIH and the research community. And so there's a couple of links here that will let you dig into what NIH might mean about what reasonable costs are. One of the things that publishers are doing now is if you publish open access and you want to comply with the mandate to make it zero embargo that NIH requires, they're asking for an article development charge. American Chemical Society, I think, was one of the first ones that came out with that. And so on top of open access fees, they will give you another fee of $2,500 to comply with the public access policy mandate. And NIH is saying, nope, grant funds cannot cover that. And that might bring up a number of questions for everyone about how do we deal with that. So before we get to that part of things, I wanted to make sure that everyone's familiar with what we have called transformative agreements within the UC libraries. And what we've done in the library is we have folded into the cost of our subscription a process of covering open access fees. And we do ask those who have grant funding to partner with us so we can make those fees spread out across as many people as possible in covering the open access fees. Now, the agreements are not always for 100% coverage, and so it's important to know what exactly our agreement is. Locally, we have a couple other journal publishers that we have partnered with here at UC San Diego. And so we have a little bit of information on, in addition to the UC systems agreements, our local agreements, and that's the link here. So since I said you kind of have to look into things and find out what exactly our agreements are, your question might be, well, how do I know? The UC system is rolling out our journal online or open access lookup tool, also called JOLT. Those of you who have been around long enough associate JOLT with a cola. That's the first thing that struck my mind, but nope, this is an online lookup tool, and that's the screenshot on the page here. If you wanted to dive into a publisher for quite a long time, the UCOP page has given you an ability to navigate by publisher and look and see what's available. If you do use Jolt, there's a link down here to see full details. And I don't know if you can see my cursor moving. I'm trying to circle the little link on the screenshot here. This is the Jolt lookup tool is something that we are uh, bringing out sort of out of a beta version. And so it's always good to verify what the coverage is and not just lean on the information that's here. And so we will try and work with you as much as we can. You can see here with Nature Medicine, it's not 100% funding. We only do partial coverage of funding with that. I found this link here, UC Open Access Fact Sheet for Researchers, and a very helpful tool. And that's why I also gave you a QR code for that one. I think that's a very helpful resource. It discusses quite a bit of information, not just open access. And so to take a step back to reasonable costs, one of the problems that we're starting to see with open access is that some publishers have taken this to an entirely different level. And so NIH has been in the discussion phase on a new policy trying to put a cap on excessive publishing fees. And that's due to come out in 2026. There's over 900 responses, some from individuals, some from organizations. The UC Libraries contributed, a publishing group called Spark was in there. Even my professional organization, the Medical Library Association, has responded to some information on that. And if you want to go down a rabbit hole on this, some of the responses are really interesting. I've put just a couple of examples here. These APCs are for one journal article, open access publishing. So Nature Medicine, they want over $12,000 to publish one article. That is, in my mind, not sustainable, not affordable in a grant, and certainly not something the UC libraries can maintain either. So that's why it's only partial funding on Nature Medicine. All right. So I'd like to get a little bit practical. So these are actual just my thoughts based on my familiarity with this process, with authoring. And that is that as you meet to discuss your project and discuss author order and who's going to do what in the project, whoever is on a grant, because it's not just the PI's responsibility, it is the person receiving that grant funds, which quite a few people get those T32 grants. It's your responsibility to make sure your work is represented and accredits the grant that you're on. Discuss who will deposit the author accepted manuscript. Now, from some of the projects I've looked at with T32 grants, there may be quite a few different grants involved in the writing of that article, in doing that research. And so it's not required that everyone on a grant deposit the manuscript. It can be one person. And so anyone can deposit to the NIH manuscript submission system, but you need all of the files related to that final submission to the publisher. And I've uploaded articles before to a publisher, and so they have the manuscript that you do have, the tables, the figures, the charts, the grants, they may all be in different files. Your supplemental material may be in a different file. So you need to have all of those. And I know sometimes when I've worked on these projects, I have a version with track comments, and I don't have that final version. So someone in the team needs to be attuned to, I need to collect those and deposit them into NIHMS. And one person can do it for the whole team. You just have to be aware that this is something you need to collect. Timing is going to be important with this. And so my thought is, as soon as you hear it has been accepted, deposit it in NIHMS, whoever is going to do that. Don't just add it to a to-do list. I know my to-do list. I'll say, okay, great. I'll do this, and then it gets pushed a little bit. And then all of a sudden things are not in compliance. What's nice with the NIHMS system is you'll set it to 0 embargo months, and the system will know when to release it. So it won't become available when you first deposited it. The system will track when it gets published and when it has to be available. So you don't have to stress too much about that process. All right. For the reviewer, I just wanted to call these two things out because this is where I've seen a lot of delays in the process happen. After you upload the files, the reviewer gets an email and says, is this correct? Is everything okay? Is all the material here? And you have to respond to that email. You just have to respond to the email and say yes, whatever they tell you to do. You get a similar email once it's been converted for uploading onto the website. And so another email goes out, and if you don't respond to that email, the depositing process just gets stalled for a little bit of time until somebody catches up to that. All
Karen,
right.
I have a question. Thank you.
Yeah,
This is Dr. Kaufman. First of all, thank you. This is very, very helpful so far.
great.
So in terms of depositing the accepted manuscript, when we get the acceptance notice from the journal, what are your thoughts on if we have that article in a journal that automatically they supposedly submit it to PMC to get the PMC number on our behalf? Should we still be uploading our own version, and would that result in duplicate versions or anything funky like that?
Well, to answer that last question first, the NIHMS and PMC are really great about dealing with duplicates. So that's really good. But to answer the first part, there are very few journals that actually will deposit for you, at least at this point in time.
Okay,
And
well,
so,
I guess
yeah,
I was 3 or 4 of the main journals that our lab publishes in do deposit, and I checked your list that you shared with us earlier, and they're on there. 3 have a 0 month embargo policy, and 1 has a 12 month. So at least for me, a lot of the journals that I submit to do deposit. And so I'm just wondering, do I hold off and let them take care of it and we're golden, or do I need to be depositing it myself when I get the acceptance notice?
if you know for sure that they will deposit for you, you don't have to worry about that. And so that'll be a good one to fold into the team discussion about that. I have seen it before where the NIHMS system actually knows what journals will deposit, and they'll tell you as you start your deposit, you don't have to worry about it. the publisher's going to do it. So they have a double check system with that.
Great. Thank you.
And so Allegra had a quick question in chat or comment with the only compliant option, and I'll show you those screens so that you're, for those who are not familiar with it, I took a couple of screenshots. The compliance with NIH rule, it's only 0 embargo months in NIHMS that will make it compliant for NIH. All right. So are there any questions? I'd planned to pause here and see if there were any other questions.
Yes, I have one question. This is Dr. Darken. So if you have a publisher that used to deposit for you, but they still list a 12 months embargo, should we then just do it ourselves because they're going to wait, right, to deposit it?
At this point, I would say absolutely yes, do it yourself.
Okay, thank you.
And so a chat question was about if we publish federally funded research in a journal that has an embargo period, do we need to arrange or pay for open access, or is it sufficient to deposit to NIHMS? So that's actually the perfect question for me to move into the next set of slides, because you should not have to publish open access. If you don't have the funds for it, and we don't have an agreement for that, we do know that some publishers are trying to push open access. And so to start with, I want to make sure that you know that there are some rights that you have just because you signed a grant with the NIH. So when you sign it, included in that contract is that federal purpose license that says that NIH, the federal agency, has a non-exclusive, irrevocable, royalty-free license. And that license allows the NIH to do a variety of things with it. And so before you've even written something, NIH has, or published something, NIH has a right to that. And so not just my words, here's a couple of links for you to follow up with those so that you'll have that in your hands, and you don't have to try and figure out in 6 months if you need to deal with this. That link will be available for you. So how can you minimize some of the problems? And so NIH's advice is to make sure that there's a statement in your manuscript that this is the result of funding with the NIH. And so I know most people do acknowledge their grants, but this NIH, they're calling it sort of like a best practice, but I don't think it's been around long enough to be called a best practice, but this is their suggested way of dealing with that. And then just making sure to minimize problems, like that question we had earlier. The publisher said they still have a 12-month embargo, okay? Then you know you need to deposit the author accepted manuscript. Can you avoid confusion with rights? And my response, unfortunately, is maybe. And so there is a guide that provides some combined wisdom for that. And you can, again, check the journal's policy page for that. So there's a certain section that you can look for, or buzzwords, you can do that. So what is the journal going to do in the author information or instructions for authors section under open access is usually where this information is found. It can sometimes be termed green open access or self-archiving. So if you want to look there for more detail about what the publisher will do. And so what if the journal is publishing or pushing you to go OA? Springer Nature is one that has done that. If you can use it, if we've got funds for it, that might be the easiest thing to do. Push back on the publisher to use the non-OA option if possible. And I realize that maybe the mouse trying to roar at the lion sometimes, but you can try it and see how far it will go. And you can also contact a couple of people. NIH, so you can email NIH to talk with them. There's a nonprofit organization called Authors Alliance, and you can, if this is something with one of our transformative agreements, you're more than welcome to contact the library and ask for our assistance with that. I think the nuclear option is withdraw the manuscript and go to a different publisher. And I realize that is a really fraught option, but that's something that people are seeing as a worst case scenario, but might be something that's needed, especially if it's a publisher where we do not have an agreement and they're asking you for thousands of dollars. So I'm sorry, there's not a really perfect answer for this, but pushing back, we'll have to see what publishers do about this. Okay. And I mentioned this earlier, the American Chemical Society. What if they're charging you for depositing the author accepted manuscript? Grant funds cannot be used for that. The NIH has already stated that they have rights to your author accepted manuscript. And so it may just be a matter of I'm going to deposit this and we'll see what the publisher does about this. And I realize that that's a risky thing to do because the last thing you want is a publisher coming after you. But the federal license with your grant does give NIH the rights to make that author accepted manuscript available. The other thing that some of you can do is to work within your own society and anyone who's an editor. Make this a discussion within those organizations to advocate for complying with the funder mandates. Sometimes the change needs to come from within the organization itself. All right. So, in a nutshell, kind of figuring out where you choose a journal. Look for that green OA depositing policy. Make sure that you know what fees might be charged. So you got to dig into that information and then verify that there's an agreement to pay the author publishing, article publishing charges. And one of the shortcuts is that Jolt lookup tool. All right. So let me pause there and see if there's any questions about any of that.
Karen, I think this was so clear. This was clearer than last time, at least for me. I don't know if it's because I heard it twice or because it's just you improved the whole lecture, but it was amazing.
Great, great. I'm glad. Well, it's a little bit slower this time. We're trying to cram a lot of things into.
Maybe that's it.
All right. I don't see any questions coming in chat, so I wanted to mention a couple other things since we're talking about NIH and grant funding, that sort of thing. And Jill, I think, might have a couple of things to mention with this. So one of the new policies is the use of Science-CV for the common form. You can't use a standalone form anymore. Well, soon. I think the deadline might be this month, later this month. And I've worked with a couple of people that have had a little bit of an issue. The system wants to connect to your ORCID ID with your profile or a biosketch form. So I wanted to show you, since I've talked to a couple of people that are having a little trouble with this, and usually it's because they might have more than one NCBI account. But to do it, you can do it through your account settings. And so when you're logged into NCBI, you can go to account settings here and you just add an account. And you can affiliate your ERA Commons account, your ORCID account, and NCBI will like that. You can also do it to a specific biosketch. And that's when you're in your products section, you can either connect to My Bibliography or ORCID. And so the advantage of ORCID might be that there are articles that do not appear in PubMed, which is mostly what people have in their My Bibliography. They just pull it in from PubMed. If you've been organizing your ORCID account, it might just be easier to pull articles from there. So I'm thinking some of our basic science researchers, you may publish in journals that PubMed does not have in there automatically. And so this just gives you an easy way to pull things into that. And Allegra put in a couple of links to help you get into some more ORCID details. Um, I I was trying to think through why they're doing this, and I think this little screenshot here can help you or help me figure out, oh, there's a certain form that they want, and as they make changes, if they have people using this online system, then this biosketch form will always be the correct one because the system will say, hey, you're on the wrong form. We can upgrade this to the correct form. A quick note on old news. Now, I know for a lot of the training grants, data management and sharing is not really something that you have to worry about, but kind of park it in the back of your brain to think about if you do a grant at some point in time. I guess this is the library commercial slide. I have some colleagues who are very proactive in helping people understand creating that data management plan. And if you have uh, data that fits within what we can host at the library, we may be able to help you work through that process. All right. So before I get to these slides, I want to show you, oh, here's your resources. I want to go through a couple of, oops, I didn't want that one. All right. A couple of screenshots from the NIH manuscript submission system. You can just dive right into that. NIHMS, you can search for that and it'll be the first one that comes up. You can enter by PubMed, DOI. You can manually type in the information. I think the easiest way is if you have it in your My Bibliography and you start the submission process, and that's just an easy click in My Bibliography. All of the manuscript details, journal title, it's already entered for you. So all you have to do is hit next. You want to apply the funding. So if you're a PI, instead of just search funding, you'll have a button that says My Funding. And it's even easier to attach the funding. But if you're doing this on behalf of several people on the team, all you need is the funding number. You do search funding. I didn't do a screenshot of that one. And then you just search for the number and it comes up. It's a really easy process. And then these are your frameworks for adding the files. Browse your computer or drag and drop. And I know a lot of people are very happy with drag and drop. So you can see it should mirror, for the most part, many of the publishers' process where you've got your manuscript, you've got figures, tables, if you have video, supplemental material, you just drop those in. So if you've gotten those as a collection from the corresponding author, who should be the one with those files, it's going to be easier. And then you just have to set it up for your reviewer. So automatically it is the person who deposited it, but you can change that. So if somebody is depositing on behalf of a team, they can designate someone who's an author or a PI to be the designated reviewer. And this is where you set your 0-month embargo. And that's the only setting that is compliant with NIH for right now. All right, I think that's my last screenshot. Yep. All right. So what questions do you have at this point? I'm going to stop my share and see what questions we have. We have a lot of informed voices on the call right now, so hopefully we can take care of that. Oh, can preprints transfer directly to NIH MS? I have not seen any connection from the preprint repositories for the NIH MS system. I would also expect that I know that PubMed is currently searching these for NIH funded research and will put them into PubMed. But when the article finally gets published, it gets a new record in PubMed and it'll reference the preprint record, but it does get a new record. So I have a feeling that they have not made an easy connection from preprints to NIH-MS. So preprints were never expected to be made available within that 12-month time period because it's not yet peer reviewed. It's going for peer review. It's only the final published peer reviewed article that is covered by the policy.
Yeah, so the basis of my question is that's typically where one would deposit the complete manuscript with all of the files while it's under review. And once it's accepted, that would be an easy way to submit. If you've already put it out as a preprint, all the files are already in one place. And that might be an easy way to move it into NIH manuscript system.
Yeah, perhaps. Although I would imagine that a preprint is going to be different than the final version. I could be completely wrong. I don't have extensive experience in this, but I know once things go through peer review, they always have something to suggest a change.
Absolutely. But if you make your changes in response to reviews and put that in the preprint server and then submit it to the journal where it is accepted, then that is the accepted version of the manuscript.
Yep. Yep. So, yeah, I think the preprint servers, in my mind, it's kind of like falling into that gap that clinicaltrials.gov is in. You're supposed to update the protocol record in clinicaltrials.gov with data. NIH has asked for that for a long time. Very few people do. And what I'm seeing with the preprint repositories is that people put their preprints there, but they don't go back in and even acknowledge that a printed article or a published article is associated with that. So it is a hole in the process.
Oh, that's not true. BioArchive and medRxiv will alert their readers in their system when that article has been published.
Okay, great. Because I've seen so many that seem to have fallen by the wayside. I'm glad to hear that the system has a process for that. Dealing with non-NIH federally funded projects. The new policy applies to all federal agencies now. So before, there were a handful of federal agencies that use NIH-MS. There's a few a few federally funded agencies that have their own system. So you'd have to check which agency you're getting the money from and what they require. So not everyone will require NIH-MS, but some of them now will allow for that. So penalties for noncompliance, the only penalties that I've heard of so far has been if it reaches a level that sort of triggers it for NIH, is they will withhold funding. So it doesn't cancel the grant. It just stops the payment of money until things are in compliance. And oftentimes that means that the article or the articles have to get through the depositing process. So that could be several weeks to almost 2 months to get back into compliance. So that could be a real hardship for some grants. Okay, so for Jill, trying to work with the trainees. Okay, so this is where the UC library pages are going to be helpful because you can look up by a journal name and see if we have an agreement. Now, I've done it a couple of times where I expected it to come up, and so it's a tool in development, so it didn't actually catch the way I put in the journal name. But that's a rare case when that doesn't come up. But that checking our agreements to see what's covered and how much is covered. Otherwise, it's a matter of before they get to the point of submitting everything, they need to look at the instructions for authors page and look at their open access and what their fees are. So it will become old hat to trainees eventually, but initially they might need to be pushed to look it up online from the publisher and see what those fees might be.
I have a question for Karen or perhaps anyone. Is there going to be, do you know if someone's going to be offering a tutorial or workshop on how to make our science CV from a BioSketch? I haven't tried to do that yet for my BioSketch. I don't know if it's pretty straightforward or if it's complicated or if there's things I'd be doing right or wrong. And I don't know if UCSD is going to be offering some sort of workshop like this to take everyone through a practice one where they have a BioSketch and here's how you convert it to the new science CV form.
So we are actually in the NIH updates meeting next Wednesday. I don't know if you're on that listserv. On January 14th, we'll be talking about the science CV. Also, on Monday, if you're part of the UC Training Grant Consortium, I'm going to be doing a presentation just on the BioSketch, the common forms, not on the other support, because that doesn't really pertain to training grants. But I'll be talking about, I'll kind of walk through the system, do a live demo. And it's pretty intuitive. Just the part that gets kind of, interesting is certifying it, which is going to be different now. But yeah, so I'm going to send that out to the listserv, information about that.
Okay, and I'm not on that listserv, so is there a way to have you add me to that?
Sure, absolutely.
Do I just reach out to you privately or?
Yeah, just pop in your
I'll
email.
just put my email here. Thank you.
Great. All right, so Allegra put in a response on a guide to choosing journals with the OA costs in regards to Jill's question. Dr. Hamilton had an interesting question that maybe between our UC folks, we can start to work on this, because this is an area of a lot of transition, and we're trying to see what publishers will do, and that is providing a list of journals by level of public access policy support. So we might be able to take a look at that. Now, I will say that one of the things you can do if you don't want to look up journal by journal is you can take a look at the UC page, which has it by publisher. By publisher, one of the things to sort of just be aware is that some of the scholarly societies, so I'll use Elsevier in this example. Elsevier does publish a number of scholarly society journals, and oftentimes those journals, they elect to not be part of our open access agreements. So it's not perfect yet, but instead of one by one journal looking up, you can go by publishers. And so that might be an option. So we've got a couple of options here for the NIH support and biosketch requirements. So if that's of interest for you, do take a look at the chat, because there's some good links and email addresses there. So we'll get you connected with people who can help you with that. And transferring to the new forms, I know there's always a catch somewhere, but the process is pretty easy.
So I've noticed there's some more questions in the chat, and we're looking at 10:59, so I know I want to respect people's time. So I'm going to add some folks to the list serve. But Dr. Schnabel put in here that there is one, I think that's for San Diego, what is it, the Diabetes Research Center. They're doing a special workshop at 3 o'clock on Monday.
Yeah,
And
anybody can join. This is
Yeah.
from Rachel Cook. We actually invited her.
And that'll be the same presentation that's basically the same presentation on Wednesday for the NIH updates meeting as well. And I've taken slides from her slide deck and kind of combined them with mine, and I'm doing more of a live version demo at the 2 o'clock one. So there'll be a lot of information coming out in the next week or so about this.
All right. And I think that's time. So thanks everyone for the discussion. I hope you found it helpful. And you have now